Oh, here we go. Oh, hello. Hi, everybody. This is Kelly Youngs from She is Fierce. I am so excited to be coming at you at 8 o'clock on a Thursday evening. I hope you have had a wonderful week and you have had a chance to relax and you've eaten your dinner and you're settling into the couch or your bed or cuddling with your children and tuning in to listen to what I know is going to be a really fun conversation. Some serious things, some fun and light things, but a conversation about wellness, self-care, and taking care of yourself as the wife, the mom, the caregiver, the professional, and all of the things in 2020. So this is the first in a series of live events that we are putting on as part of our Guide to Self-Care, a community experience in partnership with Baptist for Her. It is something we are so excited and proud to be bringing to the community. And I am honored to have this beautiful woman here with me live, Dr. Patricia Calhoun, who I have been so lucky to get to know over the last few years and always is a light for Baptist and for her in everything that we do together. So Dr. Calhoun, thank you for joining us this evening.
Thank you for having me.
Well, I am so pleased to get the opportunity to introduce you to women in our She is Fierce community and more women in the Jacksonville community, and for them to not just get to see your face and hear your wisdom, but also learn from you about, some of the practical things we should be doing right now in the middle of COVID, in the middle of a pandemic, but also some things that we should be doing all the time. And maybe this is the perfect time for us to take a moment, a pause in the middle of all the chaos around us and focus on self-care, because as everybody I hope has heard before, if you haven't, take this away with you. Just like when you're on an airplane, if you don't put your mask on first, you cannot help others. So this evening and our entire guide to self-care are about giving you the opportunity and the tools that you need to really take care of yourself, serve yourself, from a health perspective, from a mental health perspective, and just wellness generally. And then ultimately, I know for me, that is more meaningful when I know that that translates into being a better mom and a better professional and a better wife and all of the other things that I am and that you are in the world. So, Dr. Calhoun, I have so many questions for you. And I know we want to invite everybody who's watching, if you have questions, which I'm absolutely sure that there are so many questions in everybody's heads right now about what we should be doing, what life looks like, children going back to school, all of the things, traveling during the holidays. But I wanted to take a moment and start with the obvious questions around COVID and around life right now. And then we're going to get into some of the more fun things that I hope will be practical tools that we can each take with us into the rest of 2020, but also beyond. So is that okay with you, Dr. Calhoun? Can we start there?
Sounds great, Kelly.
Okay. So first of all, can I ask you to give a little bit of an introduction to everybody watching to you and your role at Baptist and for Her?
Thank you. Thank you. And thank you all for joining. I have been with Baptist Health for 28 years. I started when I was 3, I guess. No, I have been, I'm actually now the longest tenured Baptist primary care physician. I love what I do. I say I'm a round peg in a round hole. I've been doing family medicine in the same place, in the same building for all of those 28 years. I also like to give a disclaimer. I'm not a politician, and I'm not a hero, and I'm not a teacher. I am a scientist. I'm a family physician. So you'll hear things from me based on science, and I'll tell you if it's not science, and try something if you think it might be helpful, but do no harm. I'm the proud mother of 5 boys. They're kind of men by age, ranging from 21 to 32. I'm in a blended family, and my husband and I between us have 8 and almost 9 grandchildren. And life is good. So, and in case anyone didn't know, we're in a pandemic. So
if they haven't heard, honestly, bless them. And I wish I were in their shoes. So I'm so grateful for your introduction. I'm amazed. I had no idea that you had been with Baptist for so long. And I love that description of being a round peg in a round hole and having found your perfect fit. And I know, every event that we have done together, every time I have been lucky enough to meet you at a She is Fierce event or a Baptist event, I have had the opportunity to learn from you and just to see that you kind of bring your light and your fun to everything that we do. So, in that spirit, can I ask you some questions that are a little bit serious, but I think they're the questions that I know I'm asking myself every day. And I know so many women in our She is Fierce community and just all over, even all over the world, are asking themselves right now.
Absolutely.
So just to start us off with the science, as you mentioned, I wanted to ask if you can give us a little bit of a breakdown of what are all these terms that we're hearing? And I think that many of us think we have an idea, right? We went to high school, we went to college, we think we know what things mean, but I think that sometimes that doesn't always translate into the practical application when we're talking about a pandemic. So can you share a little bit about, what does testing mean right now? What are antibodies? How does that impact our world? And then finally, the one that we're all hoping and praying for, and I just said to my 6-year-old daughter this morning when she said, "When is this going to be over?" I said, "Well, they're working on a vaccine." So can you talk to us about the impact and what each of those things are and their role kind of in our world as individuals going about our lives?
Sure. And I'll be complete, but try to be brief so we can get on to some good things and focus on what we all need to be doing to take care of ourselves. So SARS-CoV-2 is the name of the virus, and the name of the disease is COVID-19. So this is called a novel virus. We had our first case in the United States the end of January, the first death in February, the first case in Duval County in March, and lo and behold, we've had over 200,000 deaths in the United States. So that's the somber aspect of it. So if you are concerned that you might have COVID-19, the infection, how do you get tested? So the testing for COVID-19 involves generally a nasal swab or a nasal pharyngeal swab. There are some saliva tests that are being developed, and you're going to hear you hear people saying, "Oh, it's just like the flu," and I will very quickly dispel that myth. It's not, but I'm going to use that as an analogy because we all kind of know what the flu is. So for the flu, we've got rapid testing. You can go to your doctor's office and get a test in 7 or 8 minutes. We've got immunizations for it. You can get a flu vaccine every year, which, by the way, I do encourage everyone to do if they don't have a medical contraindication to doing it. And we've got treatment. We've got Tamiflu. If you catch the flu early enough, we've got all of those things for it. So, and we've known about it and we know that it shifts. So we've kind of built some immunity to it. So when you do a nasal test, the nasal test is checking for the virus through either an antigen or a molecular test. So that's checking for active disease. Mm-hmm. So when you're concerned that you might have it, we've got a website a phone number for Baptist that we refer people to as well. That is a nurse hotline staffed during the day that people can find out where to be tested because this is changing daily. Yeah. The city of Jacksonville also has a very robust site, and I'm not one for necessarily remembering websites. It's jaxready.com. But if you just Google COVID-19 testing Jacksonville, Florida, it'll rise to the top, and you can, and it's updated all the time, and there are free places to be tested. Most of the testing is not immediate. There are some immediate tests that can be done, and some of those have limitations as well. So you really want to know when you're being tested, what's the sensitivity or specificity? In other words, how good is the test? Are there false positives or false negatives? Almost every test that's available now if it's positive, it's positive. So there's not a cross reactivity with other things that are going on. So those are the actual COVID-19 tests. And again, you can find where to be tested. I will defer any information on, when I should be tested and so forth. I think that's beyond the scope of what we're going to try and focus on. Then there's the antibody. So the antibody is what your body makes after it's been exposed to an infection. So there's a lot of controversy about how long the antibodies are going to last, and do they confer immunity, meaning do they keep you protected? So we think at least we've got a good 3 months of it, because remember, this just started back when I told you early 2020. So we don't have a lot of data on how long the antibody levels are going to be around in your body to fight it off, for instance, if you get exposed again. So we're still requesting, as a medical community, again, as scientists, to wear your masks, to pretend like everybody could have it, practice social distancing, wash your hands frequently, avoid high touch surfaces, those things that people are probably tired of hearing from the
Yeah.
scientific community, but that's our only defense right now.
Yeah.
And then the vaccine. So I love analogies. And here's my analogy. Pretend across the United States, you have a brand new roadway system and you get to make vehicles. Well, what are you going to make? Are you going to make a motorcycle? Are you going to make a car? Are you going to make a semi? Are you going to make a crossover? Are you going to make a truck? So right now, everybody's scrambling to make those vehicles. They're scrambling to make the types of vaccines that we are going to be able to have to get into our body to then fight this off. And it's novel. It's a new virus. So the old vaccines, while they're being studied, we have to look at other ways to get vaccines into the body to be able to do that. And that's where we are now. We're hopeful. There's a lot of things that we want to balance as a medical community, safety and efficacy. So, kind of stay tuned. We don't have anything right away. It's looking promising in my perspective into next year, kind of spring maybe of next year. And then my patients will ask me, Dr. Calhoun, should I get the vaccine as soon as it comes out? And my answer to that is a little cynicism, but we can all laugh.
Yeah.
You get toilet paper in April. So there's a lot of logistics around creating a vaccine and getting it to places. So, stay tuned. Don't fret about it. There's nothing I can do or you can do to make it get here quicker.
Yeah.
It's one of those things. It will get here. We are in this together. I love the word together, because we are in it together, and we'll get there.
Yeah. Okay. So first of all, I want to say that you just broke down 3 really complicated scientific concepts in about 3 minutes. So more power to you, and I'm grateful to you for doing that. I think that, to your point, each and every one of us who is not a doctor, who doesn't have a medical degree, is trying to figure out how each of those things apply to our lives. But as you said at the end, and one of the principles that certainly within the She is Fierce community, and I know even within my own personal community of friends, we have been talking about, is that concept of being in it together, right? And I love, as we talk about self-care, the importance, and anybody who has shown up, we were doing Women's Wednesdays morning show for about 2 months, and we have some more coming up. And every single time I found myself at the end of our show talking about, whether it was on topic or not, the idea that people need to find a support system. That if you are struggling, if you are, from a physical perspective, if you are struggling from a mental health perspective right now, whatever that looks like, wherever, if people are trying to work on their business, whatever it is that someone is doing, we have to build strong support systems. And I think some of us come with those already in place, but a lot of us have to go out and find the people that kind of fit our world wherever we are. And I think that's especially appropriate conversation for 2020. So one of the things that I just love in our self-care download, it's a guide to self-care. And I want to make sure that everybody knows that they can go and download this. It's sheisfiercehq.com/self-care. And I know we will share that link as well. But if you go and download it, I want you to open it up to page 4. And honestly, this is my favorite page.
Oh, thank you.
There's a lot of really practical advice. There's a lot of wonderful wisdom around, health and staying active and, cooking and all of the things that are very important for your wellness. But from my perspective, if you are not in a healthy mental place, then all of those things become infinitely more challenging, right? So I love your page 4 in our challenge or our guide, where you talk about these 5 principles The first one is just be patient. So can we just talk through these principles and what they actually mean for self-care and for individual women in this moment in time? So I'm just going to list them out, and then will you talk them through with me?
Yes.
The first one is be patient. The second one is be safe, right? So being able to live your life, but also focusing on your safety and taking care of yourself and others. Being prepared, being creative, which I love that one. I think that so often that is left out of the conversation of health or self-care, but it is so critical. And then finally, being kind. And I mean, if there was any principle that I think should underlie everything that we do, it is this concept of being kind and respectful to yourself and one another. And I think that each of those principles really underlies everything that we're going to talk about for the next couple of months within this self-care experience. And that I hope, as our community of women who are participating with us grows, that those principles come to life. So there's so much goodness in these 5 things. Can we start with the idea of being patient?
Yes, and that's really difficult for me because I do want things done now. And as physicians, I think that's one of our faults at times because we're used to, we're used to dealing with some of those critical situations and, it needs to be done now. We need the oxygen now and we need the crash cart now. So just in my own professional and personal life, that's one that speaks to me. So I'm preaching to myself as the choir on that. And we do need to be patient, but understand that, again, kind of one of those things that what can you change and what can't you change? So being patient with your scientific community, being patient with some people who are just not behaving properly, and we'll leave it at that.
Yeah.
Being patient with yourself. So that's important as well. When you're in a pandemic that things have changed, your gym is closed down, the weather's going to get cool so you can't swim in your pool, or you just don't, you're working differently, you're working at home so you don't get a chance to do some of those other things and move more. Maybe a few pounds, like for all of us, have crept on during the pandemic. Be patient, that's okay. Figure out ways to get through it, and don't be too hard on yourself.
Yeah, I love that. And I will share something that I know, if people came to our summit last year, they will, or very early this year, it feels like 3 years ago now, they will probably have heard me talk about this, but I know that this experience of everything that I personally have been dealing with, which is very different from what everyone else has been dealing with, as each of us have our own unique situation. But for me, this experience has been so informed by an experience I had a couple years ago where I had 2 small children, I was running a business, my mom got sick, we had all these things happening. And the idea of being patient was so challenging for me. And taking time and recognizing a lot of the principles that we talk about within this self-care guide kind of transformed both my family life, my own sense of, as we talked about, being respectful to yourself and respecting the fact that you need time for your mental health. And these principles that you talk about, I know I certainly have experienced them in a different time in my life, and I have been able to translate that to now. But sometimes, I'm in so many groups with so many women, we're always doing stuff. And a common theme that I have heard, particularly professional women talk about and moms talk about, is just overwhelm, right? You want to do all the things. We look at something, we think a self-care guide sounds wonderful, but how will I fit it in? We have this challenge of how do I actually make that happen? It feels like another thing to add onto your plate. So I love your idea around being creative and taking yourself out of, you must do this, you must do that, you must, fit in this thing that applies within this guide. And as much as I think every single one of us wants to enact every principle that we've laid down in this guide, if we can simply be kind to ourselves and others, we are already infinitely further ahead. So let's talk about the idea of being creative, because I think that really fits into this conversation.
So women you all are smart. You can balance things. You can come up with creative ways to cook, to clean, to work, to take care of your children. I'll quote one of my favorite quotes that goes like this: "No one ever asks a man, how do you do it all?" So we are sometimes tasked with doing it all, and now there's a lot of things that we just are not allowed to do or can't do, or has been shut down again for a while. None of this is permanent. It's just this pause. So it's a bigger pause than any of us would like. So coming up with ways to be creative. Maybe it's things to do with your children, and Lord knows there's no way. Bless every mama that's taking care of their kids, because I told someone today, if I had to have those 5 boys at home during this pandemic, I can't think of an age, like, would 4 to 14 be okay, or would 5 to 15 be okay? And it would be like Dr. Seuss. Behind me, you would be seeing like thing 1 chasing thing 2, and thing 3 chasing thing 4, and thing 5 being held up by one of them. So, my heart really goes out, and do your best, and be creative in the things that you can do for your own health. Maybe you can't go to the gym anymore. Walk more, and find places to kind of change some of those things up. Oh my word, there's tons of yoga and workout programs that are free online that you can still do. And I'm going to share this because it kind of combines the being patient with being creative. And it doesn't mean that you have to go out and make homemade cupcakes every night of the week and decorate them beautifully. And I wish I had learned this earlier in my life and career. And it's a French philosopher, Voltaire, who said, and you've probably heard it, Kelly, don't let the perfect be the enemy of the good. Maybe you're exhausted, and you've been dealing with a 4-year-old and a 7-year-old and a 9-year-old, and trying to do virtual school, or they're coming back from school, and you can't run 5 miles or 3 miles. Maybe go for a 1 mile walk. Take that 1 mile, or maybe you do something for yourself and have a cup of herbal tea and sit quietly with a candle on somewhere, if you can find a place quiet in your home. But don't let the perfect be the enemy of the good. Even if you do a little bit, you're going to reward yourself, and you deserve it.
Yeah. I love that. And as you're speaking, of course, I'm thinking of situations in my own life where I have had to, and I certainly, like so many women in the world and in our community, I certainly always want to do everything myself, and I want it to happen right away, and I want it to be perfect. I don't know if anyone else struggles with that, but that is, but that is absolutely, as much as I think that I am not like that and I'm not crazy, I am a little bit. And I sometimes, as soon as something comes up for me, or as you said, as soon as there's a goal in mind, I want to strive towards that, whatever that goal might be. And I do think, to your point, having the willingness to allow self-care to be, the goal is simply to care for yourself, whatever that looks like. So you can still feel like you've achieved your goal, but instead of your goal being, I must run 3 miles, it can simply be, I took 30 minutes and I did something, right? Or to your point, which is fantastic, I took a book and I read half a chapter with a candle next to me, and I got a moment of pause. And I know one of the biggest challenges that so many of us have in this, certainly within 2020, I know my kids came home in March, and they only went back to school about a month ago. They stayed out for the beginning of the year. And so I was with my children pretty much 24/7, although I cannot say that I cannot claim anything better than you, because you have 5 boys, and I have no idea how you did that. But I have a 6-year-old and an 8-year-old who I adore and I love to be with, but we were together pretty much 24/7 for about 6 months. And of course, I was still working and still doing all of the things. And I had to kind of force myself into, it's okay for me to take a call standing on a beach, watching them in the ocean, because that's all it has to be now. I can't have them sit at a desk and force them to be unhappy. And so I think that, I don't know, that's kind of a crazy example, but that experience of saying, in this moment, I'm going to do the thing that is serving the greater good, right? And also taking care of yourself, right?
And that was your creativity.
That was my Sometimes creativity is not, to your point, it's not the beautiful Pinterest thing that you make. It is being creative in the way you approach things. Absolutely.
And to think about what you can do. Don't think about the things you can't do, and really try and dispel some of the negativity. And we all know negative people. Try not to be negative towards yourself. So it's really easy to say, "Oh, I can't go to the gym," but think about what you can do.
Yeah.
And there's so many opportunities.
I love that. Yeah, and I have to say, some of these other questions that I want to ask you, we really can think about what is possible in them, right? So as much as you mentioned, and I think every woman I've spoken to has said something about this, which is not a good thing, but that many of us have gained weight, or even if you haven't gained weight, maybe you feel like your health has suffered. You haven't been able, as you said, to go to the gym as much, or you haven't, just had this space that we're talking about. You haven't had that time for self-care, which a lot of times I know I find in my life, my wellness translates to how much I have to do, right? And whether I allow myself that space for self-care. So I know that every single one of these principles that we have is really applicable for me. And so I love this guide even more. But some of the things that I wanted to touch on are around, healthy living, wellness from a diet perspective, although I don't mean diet, I mean simply what you put into your body, and how to maintain, I think, consistency when we have all of these other things. So the example that I gave, and I know many women who are still homeschooling their children and working and what is your kind of advice in this crazy time to not necessarily go above and beyond and suddenly become the person that cooks rotisserie chicken a homemade chicken every evening, but simply somebody who is putting healthy meals on the table?
So I talk about my triangle. So in my triangle, and I counsel my patients with this as well, is eating healthy, exercising regularly, and sleeping well. So not just sleeping quantity, but sleeping well. So kind of if you get that balance, and eating healthy can mean many things to different people. So I'm a whole foods Mediterranean diet type of person. I personally just like that as a style of food, and part of it is the thinking of it, because nobody wants to run out to the grocery store 5 times in a week. So again, that kind of goes back to even some of the simple things that we mentioned as far as the weight gain that many women are experiencing. We're just not moving as much. All those 5 trips per week that let me run into the store and get this. Let me run over. We kind of, again, we pause, and do I really need to go now, or aren't they telling me to make a list and then just go once a week instead of 2 or 3 or 4 times a week? So eating healthy, and down the road in some of our programming, I know we're going to be talking about some of those things as far as healthy diets, and I don't even like the word diet, but just a healthy lifestyle as far as food intake. And then exercising regularly. Try and get 20, 30 minutes a day to do that. Again, if you get 10 minutes, don't let that perfect be the enemy of the good. So, try and do something regularly to help take care of yourself. That it gets your oxygen flowing, it gets your heart rate up. So it does so much more healthful things for you than just, building your muscles. And then sleeping well. And that's a really tough one during the time when your mind is thinking about all those things that you need to do. And your world may have changed, that your world is just your world in your home, and you're not into a routine that you used to be in. So all the change can make a difference in how well you eat healthy, and how you exercise, and how you sleep.
Yeah. Well, I love your example of, people having trouble sleeping simply because our routines are thrown off, right? Our habits that we are so accustomed to, that we sleep a certain way, we turn our face a certain way when we're sleeping. All of these things are thrown off as we adapt to so much change around us. So of course, the thing that comes with that is stress, right? That is the underlying factor. The stress of not being in the same situation that we're normally in, the stress of having to become a homeschool teacher, the stress of keeping your job or struggling to find a new job, all of these things that don't seem to have anything to do with your health, but of course have an incredible impact on your wellness and your health. So do you have any advice, as we not only are dealing with the pandemic, not only everybody dealing with all of these different factors around them, but also coming into a holiday season, coming into a season that, as much as I want everyone to love the holidays and get through it with joy at every moment, I think we all acknowledge can be even more stressful, especially for women, right? Because we carry the burden of creating the beautiful experience for everyone else. And particularly in this time, there's the additional stress of, I want to be with my family. Should I be with my family? There are all these additional factors. So is there any, and this is a really tough one, I think, because there's so many elements to it, but do you have any advice around not necessarily resolving that stress, but managing that stress so that you feel well throughout the day? And as you said, you can sleep well, you can manage day-to-day incremental stress.
So I'll go back to some of my points, being be safe and be creative. So I'll kind of focus on those two. So yes, the holidays are coming up. We have Halloween and we have Thanksgiving and we've got Christmas and New Year's, and those are generally loaded with lots of visits to different places and family visits in, or your visits out to other family members. So I analyze your individual situation because we're all very different with that. There are folks that have vulnerable people in their family immediately or at distance, and that goes to the respect. So, an older family member that's out of state may not want you to visit. So, being safe from that standpoint and understanding, again, this is something that's temporary, and it's just that it's all temporary at once. And that's what makes it stressful. So you kind of identify those things. What do you want to accomplish? So identify for your holidays. Do you want people together? Maybe, again, be creative. Think about how our wonderful restaurants are doing things and they package stuff up for you. So maybe you create a really cool distanced Thanksgiving where you have different tables set up at your home. Say you've got 15 or 20 people coming in, and you have little family pockets of tables. And this is just totally off the top of my head, kind of coming up with
that idea. And no, we don't have that many people, but we are probably going to end up doing a version of that because my grandparents, who are in their late 80s, live in the neighborhood next to us. And just like so many people, we talk to them all the time. We sometimes wave at them, but we haven't really come into contact with them because now my children are back at school. So I think that's such a great, and I love that. I just love coming back to the idea of being creative with your wellness and being creative with the way that you approach the world to allow yourself space for that self-care. So I love that principle. Okay, so I know we wanted to try to keep it to about 30 minutes. So as we wrap up, I know I see all these beautiful people are saying hello to you, and thank you for your encouragement. Karen is saying, I walked my neighborhood more since COVID than I have since I moved into our house. Yes, I just have been desperate to buy a bike because I missed that wave when everybody bought a bike in March, and have just discovered that I can buy the bike that I want. And I got really excited, and I thought, this is irrational excitement about this bicycle. So I understand. Kara is saying, love Dr. Calhoun. She said, I sleep so much better when I exercise during the day. And Karen's saying, love the creativity aspect. Yeah, I mean, I think there's so much gold in everything that you've said tonight. And again, coming back to these principles, your original principles that we talked about, being patient, being safe, being prepared, being creative. And then finally, and I think the most important one right now, as you said, because we're all in this together, is just being kind and respectful to one another. And then, of course, I'm adding in, and to yourself, right? Being kind to yourself, being patient with yourself, and accepting that sometimes things don't go as you want them to, and that's okay, right? And we can move on. So as we wrap up, can I ask, while I have you, will you share your last words of wisdom for women who, I know we have lots of women watching now, but we'll have many who watch this tomorrow and over the course of the next few days who are kind of tuning in, looking for inspiration and practical wisdom to get their self-care in order?
So first of all, definitely take time for yourself. One of the principles in medicine that we teach each other as you come upon an emergency scene is take your own pulse. So take your pulse. Where are you in this? Are you doing okay? Can you help someone else? Are you really struggling? Ask someone for help. There are people everywhere that are willing to help you. And while you may think that your struggles are beyond the capacity for someone else to help you, please reach out. There's physicians, there's friends, there's counselors. If you're really, really struggling, don't neglect yourself so much that you don't reach out for help when you really do need to.
Yeah.
And again, remember, don't think about those things that you can't do. Think about those things that you can do.
Yeah. All right. So, of course, beautiful words of wisdom to end us on. And I'm so grateful to you, Dr. Calhoun, for spending your evening with me. And of course, every single person who joined us live, thank you so much, everybody. And I know as everybody kind of gets the chance to experience this over the next few days, if you have questions for, I'm guessing, Dr. Calhoun, you're welcome to tag me if you have a question for me, but we've got our wise doctor here with all the wisdom. So please tag for her, tag me, and tag Dr. Calhoun so that we can actually jump in and hopefully be of help and of service. And as you just said, be that person to lean on when you might be struggling with something or when you need a little bit of help. And of course, as you go to the link, which I know we're going to share, it's sheisfiercehq.com/self-care. You can download this complete guide. You can join us every Thursday at 7 o'clock going forward. And I will be here. We will have Dr. Calhoun again. We will have many other Baptist for Her experts and other women within our community who are bringing their expertise in so many different areas around wellness, health, and just this concept that is so critical right now of self-care in this crazy time. So thank you again, Dr. Calhoun, for joining me. I'm so grateful.
Thank you.
It's been a pleasure. And thank you to every single one of you who joined, and we will see you very soon. We'll see you next week.